Hopefully you've noticed that we are trying to highlight more of the good things happening in our community with our What's Good stories. So tonight, we want to introduce you to a doctor who helped a veteran who thought he may never walk again.
I'm Army in Army National Guard.
William Quinn is a proud veteran. He's led an active life. So when it got hard to move,
You talk about depression. Depression's real.
life got really hard.
You couldn't walk. I couldn't mow the lawn. I couldn't go upstairs.
William went to the doctor. He says an orthopedic surgeon at a Kentucky hospital told him that he needed hip surgery. But unfortunately, William says the procedure the doctor performed late last year only complicated his issues and left him in further pain. He couldn't walk, was wheelchair bound, couldn't work anymore.
I have a psychiatrist that I see, and he asked me, he said, "Are you suicidal?" And I said, "Absolutely not," but I could see how people could do it. That's how much pain there was.
It was 8 months of agony. William saw several different doctors to see if they could help him.
Then we went to 2 other orthopedic surgeons. They said the same thing. It's irreversible, it's terminal, and you're going to be in a wheelchair the rest of your life.
The veteran who served feared the rest of his life would be served to him without independence. And then William says he was referred to Dr. Andrew Swergis, an orthopedic surgeon at UofL Health.
You know, when someone comes in with something like this, when they've had another operation before, you have to start digging in.
His first words out of his mouth after he saw the x-rays, he goes, "I need to put my detective hat on."
He wanted to get out of the wheelchair and wanted to get back to walking and doing the things he enjoys doing. You know, the thought is, well, we need to give him a new hip joint.
Dr. Swergis determined William needed hip replacement surgery, but this was a little complicated.
He didn't have a standard hip joint, and so we went in there and had to debride a whole bunch of scar tissue. His leg, you know, he had this surgery about 10 months prior to when we did his hip replacement, so his leg had been short. You know, your leg shortens when you don't have a hip joint, so his leg was, you know, 5, 6, 7 inches shorter than his other leg, and all the muscles had tightened up, so there was a lot of scar tissue and a lot of mobilization to do. And then we go in and put a socket in like we would usually do for a hip replacement, and then we put a stem in with a ball on it, but then we have to, you know, bring his leg back down and put the ball and socket joint back together.
This is what William's hip looked like before the surgery. This is what it looks like now.
I'm still getting goosebumps right now.
3 days after the hip replacement surgery, William was standing and walking.
He gave me a gift that I could never repay, and that's the gift of mobility.
William is now paying it forward and getting back to what he loves, which is to serve. Soon after walking, he joined the American Legion and is a part of the Honor Guard.
I'm able to stand and salute these soldiers that give us the safety that we have right now. Hurt, but I do it for Dr. Andy.
William, do you feel good again?
I do. I have a smile now.
And Quinn is a proud veteran. He's led an active life, so when it got hard, of course, this was also very devastating for him. And what he says right now that he wants to do, he's working right now, this time as an Uber driver. He hopes to be walking without assistance by the end of the year. If you know of something good happening in your community, just let us know. Email what'sgood@wave3.com.